Hi, welcome back. Now that we have reviewed the importance of day sheet selection, let's go into our charges and payments. You can access charges and payments from our shortcut icons in the bottom left corner or from our billing drop-down menu in the F6 shortcut key. I'm going to go ahead and click on that link. Remember that charges and payments will automatically populate a day sheet or encounters or charge slips that were printed associated with a particular day sheet. So anybody that was selected on 11/27 and printed a charge slip, those charge slips will show up when I'm connected to that 11/20 day sheet, 27 day sheet. Notice my day sheet date is blinking in red. This means that this is not the current day. I'm posting for a date other than current day. We're going to look at that by going to our miscellaneous and day sheet select. You'll notice that today's date is 11/26. However, I'm connected to 11/27. In actuality, I want to go ahead and go back to the 23rd and post for the 23rd because that's my next day. 11/22 is complete. I just need to balance and close that day. But I can go ahead and begin posting charges on any other day. The one thing to keep in mind, and we'll go over this in daily close, is you always want to open your day sheets in date order and close them in date order. So I never want to, if I complete the 23rd and I'm balanced, I don't want to close it until I've closed the 22nd. Let's go ahead and connect to the 23rd. We do that by selecting 11/23 and hitting accept. I want to go ahead and get those charges posted. And I'm going to go back into charges and payments, and you're going to notice it's changed my day sheet. My list of encounters that have been printed will populate. Some of the icons, let's go through these under our charges and payments menu. Unit posting allows us to post a single payment across several dates of service for a patient. We'll look at that when we go over payments. Batch options is also something we'll review when we're posting payments. Toggle display, again, this would be utilized more for EMR purposes, but you can play with that. It's not really a necessary function. Display order, so it may be something that you want to look at. This is for your individual user. If you don't like the columns in the way they're arranged, you can change those by drag and dropping and moving things or taking things completely out. Pending charges log, it's not something you're going to worry about unless you're utilizing an EMR, and we'll train on that if your practice has an EMR and are using pending charges. An exit window just closes out our charges and payments. So there are a couple of ways we can do this. Notice that my menu is very limited, but if I were to pull up a patient account like Anthony Smith, you'll notice my charges and payments window changes to posting sequences, and now I have a bunch of different options. I can create a new charge, which would mean it's going to add a new row and it's going to create a new data service. I can save my changes. I can highlight a data service to post a payment. We'll go over that in payments, which will be next. I can create just a general note on the system related to just this patient's account by clicking on that and hitting the word new, or review notes that have already been posted. General is not related to any one particular data service. It's just what it says, a general note. We'll review how to create a note specific to a data service. Unit posting has to do with posting a single patient payment, like say $125 check, across several dates of service, and we'll see that in our payment posting training. Batch options, again, payment posting training. The billing inquiry, that's just going to take everything you're seeing here, all the dates of service, and break it out into a patient ledger for you. And so you can see each data service is parsed out by gray, white, so that they're a little easier to see. You have some filters up top so that you can filter out for a particular time period if you want to. Change them to descending to be account based, or not to display your non-zero accounts. You can also see your patient aging buckets And you can choose those related to a particular case if you want to, like a work comp case that you have on the system. You only want to see the charges for that, or a particular injury. I'm just going to go ahead and exit there. Remember, always read your title bars in this system. Everything starts on the title bar. So we're in patient sequences, and if you're calling in for support, it's helpful to know where you are in the system. For instance, if I had a problem on this account, I would say I'm in the patient sequences for account number 1001, Anthony Smith, and I'm having trouble, blah, blah, blah. Okay, so we can see our patient information. We can see remarks carrying over from the demographics. Remember, we talked about that. We can also see that alert field. We have those same icons that you see in all the other screens, appointment, demographics, etc. I have the appointment correction. I have the ability to force a statement if for some reason I'm dealing with this patient and they didn't get a statement, and I know we just said when I looked it up in their account, I can just say, sir, we'll send you a statement and the next time we process them, and I can check that box. And so that will override the system settings that say, if this patient got a statement in the last 30 days, don't send one. This is going to override that and say, send a statement to this patient regardless. The next thing you're going to see is the primary default insurance. Now, this patient may have other primary insurance. Let's just say that we're treating this patient for a medical case, but we also have a work comp case on this patient. This is merely telling you that you're looking at a set called medical. And let me be very clear on this, because this can get a little tricky. So let's look at it. Here it's saying we're looking at the set medical. Well, that's referring to this set right here. We could also change that to look at set work comp. And so keep in mind, and I'm going to go ahead and close out of that this patient may have other plans. And as I scroll down, notice my set changed. So it's allowing me to see all insurances on the system. Your cutoff days can be set to whatever you want. This is only looking back for 180 days. Well, we're in 2012, and notice I'm seeing some 2009, and the reason is there's still a balance. So anytime you have a balance on a date of service, it's going to override our cutoff days. Cutoff day says if it's zero balance, don't display it after 180 days. But let's say I need to go back and look at the history. I can highlight that 180 days and change it to anything I want. The default of 9,999 and coming over here and hitting search is going to bring back everything on this patient account, whether it's zero balance or not. Or I can override that 180 and say I just need to go back 1 year and hit search, and it'll bring back everything for the past year. So you can override on the fly. Another thing to look at in this screen, we have a posting date, which could be different than your date of service, which is the service column. This column here is specific for printing or editing, and we'll look at that in just a minute. Sequence is basically the system. Every time you create a charge on the system, it's going to number the sequence. So each date of service is going to have its own sequence number. Now, some practices create more than one encounter for the purpose of billing out charges separately. For instance, you may provide medical treatment and then some kind of rehab or physical therapy, and you might need to bill those out separately. And so in that case, I could have a date of service that has more than one sequence. This is my medical sequence, and this is my physical therapy sequence, and that's fine. Just each time you create a charge that would go out on a CMS form by itself, it's going to associate a sequence number. That's just something that the system uses to track how many different claims are created. I guess that's a better way to put it. The next column tells you how many line items are in that sequence. If I bill out a single charge, it's going to show one, but when I post an adjustment and a payment, those are two new line items, it's going to change to 3. Next, it's going to tell us who rendered the care, what the balance is currently on that data service, and who the current responsibility is on that particular line item. Notice I can right-click on these, and I have some options there as well. Claim status would require that you subscribe to a particular service, so that may or may not be available. What's this is just a tooltip that allows you to click on, and it tells you about that field. So anytime you're in a field and you're not sure what it is, just right click and say, what's this? And it tells you about that field. Collection payment, we'll review this in the collection series. Split sequence. This can be very helpful. Let me go on to another data service and pull that up. So this would allow you to split a sequence and split the charges in a sequence to say, I want some of them to go to insurance, but I want this line item to go to patient. So even though you've keyed it all together, it'll allow you to split those up, and even create a separate one. So if I had a scenario where I had medical charges and then I had some with physical therapy and some were medical, and I needed to separate them out, I could use that to do it if I didn't do it in the beginning. Reorder sequence, that's another thing that can be helpful. If maybe my office visit's on top, or maybe I had my EKG on top and I needed the office visit, I can drag and drop these and position them in the claim so that they go out in a particular order without having to open everything up or delete a row and key them in order. So you can change the order even after they've been keyed in by right-clicking on that data service and choosing Reorder Sequence. And finally, if an account has been pushed over to collections and it was an accident, an error, or for whatever reason you need to remove it, you can choose Remove from Collections, and that's going to automatically reverse the collection process on that account very cleanly, very easily, very quickly. Let's talk about some of these little color symbols and things that we're seeing. This red line here indicates that there are sequence notes. Remember, we talked about general notes being an overall general account note for the patient. Well, we can also have data service specific notes. So when I put a check mark in that box and I hit my sequence note because it's related to sequence 3, I'm going to be able to see the notes. It's telling us when the claim was filed. Some of these notes, notice they say system. System notes are generated automatically. Anytime you process a claim, if I send it out electronically or print it to paper, the system's going to generate an automatic note on that telling the date, time, and the user that performed that function. Anytime a claim changes responsibility, for instance, I post payment to a primary claim from the insurance company, the system will automatically rotate it to the next level, which may be secondary insurance or may be patient, depending on the patient account. The system's going to make a note saying it rotated from insurance to patient and so forth. Some of those are system generated. Then you have user generated. If I wanted to add a note to this data service saying that spoke with insurance, Sheila, at 800, this number, and she is telling me to resubmit and they will pay in 30 days. I can make a note of that, and then I can go ahead and resubmit the insurance. After you create a note, make sure to say accept so that it keeps that note. So now when anybody else goes in there, they're going to be able to see all of the notes on the account, including the one I just created. And also print notes. And when you want to print off these notes, you can choose to exclude certain ones by unchecking them. So when you go to print, all of these other things are not going to print. AR Express is an add-on module, and we can discuss that very briefly later just to let you know it exists in case that was something you wanted to do. Okay, So the next thing we have is this blue line right here, which tells us that there's a copay that's not been paid on that particular data service. So this patient has a copay and it's not been paid on that data service or any of these. This triangle that you're seeing here is telling us that there's a problem with the claim. Now this is an add-on service that you may or may not have, which is called Claim Scrubber. If you have Claim Scrubber, it'll give you warnings and so forth on items that it thinks may be problematic or face some kind of rejection from the insurance company. And finally, the teal green line that you'll see over to the left-hand side, that's indicating that there's an unapplied payment. There's unapplied money on this patient account. In this case, we have a $10 copay that has not been applied. And we'll look at that in our payment training. That's going to be part of that. Okay. So now that you understand the patient sequence screen and you understand your icons, let's go into posting. I'm going to back out of the patient account. And actually, I'm going to back out of this whole window and I'm going to hit my F6 shortcut key for my charges and payments. And notice when I do that, watch down here and notice which one lights up. Charges and payments. I'm at the search screen. If I pull up a patient account, it searches, it gives me the primary account, and below it's telling me there are other accounts associated. So I'm able to see Anthony Smith, the primary 0.0 account, but I'm also able to see his dependent account, the 0.1 Charlotte Smith account. I can see any patient due monies as well, and overall account balance. If I wanted to select one or the other, I would just simply down on the bottom half, double click on the patient name. It's going to take me in. And I know which patient I'm in by reading my title bar always. Now, when I'm ready to back out, I just simply close this window, or I can hit exit window. I'm going to go ahead and just hit the X, and it takes me back to my charges and payments search window. Even though you're seeing Anthony Smith, I can key right over this number with a name or another search. And when I back out, I'm back to my search screen. I don't have to backspace. When it's highlighted like that, I can just simply start typing, just like any Windows product allows you to do that. But in this case, I want to demonstrate to you how to use the charge slip list to post payments. So let's pretend that we have all of these encounter forms in front of us, and I'm going to post each of these. I'm going to just double click on the first one. Peter Paxton is the one I'm about to post. I simply double click on Peter Paxton, and it takes me right into the charge entry screen for that patient. I know that I'm posting on the 11/23 day sheet, and I want that date to match the date of service. Notice the insurance that it's trying to post to. It's posting to Medical Mutual of Ohio. Now, I'm going to do Control F5 to pull Anthony's demographics up, because I want to look and see where that insurance is. So he only has the one plan set. If he had multiple, in fact, let's go ahead and do that real quick. I'm going to just add him a work comp plan set, and we're going to put plan number. We'll just say that that's what this is. All right, and let's save that. And I'm going to exit. And I'm actually going to go ahead and back out of this charge screen. Notice I didn't save anything. I just backed out, so there's been no charge posted. And I'm going to go back into them. Okay, so now you can see that it's automatically wanting to post to his medical plan set, but he also has a work comp, and if I wanted to bill to that work comp, I just simply hit the drop down, and now Control F5 to bring up the demographics just so you're seeing this. Notice that I switched it to this one. Why did it want to bill to the Medical Mutual? Well, because that is the default plan set on the system, but when I come over to work comp, that's not default. Doesn't mean I can't bill to it, just means I have to tell the system when I want to. So I can toggle between his different medical plan sets, and it's going to tell me, oh, okay, you want to send it to mutual? No, I don't. I want to send it to his work comp because he's coming in on the accident that he had. Okay, so I can also come in here and bill out my diagnosis codes. Now notice at the bottom it's giving me the last diagnosis codes billed for this patient, and I got to change it off work comp because we're just going to make it a medical case. Well, I should come to location. You can change if you have multiple locations that have their own information, or you just are keeping track of different locations, like clinics outside of the main office. You can do that by clicking that drop down and billing to those or being able to track those locations. Different than our service facilities. Service facilities are going to have credentials related. They're going to have facility, NPI, and so forth. Where location is always going to use your practice NPI and facility information from your main practice. It's just saying that you have other offices, maybe a north office and a south office, and so forth. So where a service facility is different. How do we change our service facility? Well, remember, we can either start typing in letters for a partial name, or we can type in a facility number if we know it. Or if I don't know anything, I can put a % sign in there and hit enter, and it's going to give me all the possible facilities, and those would be listed under maintenance and service facility. Here, all of my facilities here can be populated on my claim if it's appropriate. If there is not a facility, then I simply blank this out and I don't add it, and it's not going to input any service facility information on my claim. Okay, now we're down to diagnosis. Notice you have 8 diagnosis fields. Keep in mind, each procedure code can only have 4 diagnosis codes related to that particular charge. I do want to point out that it will track the past diagnoses and or chronic diagnoses. If I want to I don't want to key all this in, but I'm going to use, he's coming in for the same case. Watch how my cursor changed to like a letter I. It's kind of hard to see. When I left click my mouse and hold it, I can just drag and drop all those codes into my current charge. I can also uncheck one. I say, well, I'm doing, the asthma and everything, but we're not doing any kind of special screening this time. And I can just drag those codes in. So it's only using 3 of the 4. I'm going to go ahead and stick with that. And so the next thing I'm going to do is I'm just going to hit my tab key to tab and create a new line, or I could have just hit new and it would have brought me right down here. This is where my procedure codes go. Let's put our office visit level at 99213. Our place of service is office. If it was other than, I'm going to hit my drop down and choose the appropriate one, or I'm simply going to key the number. If you need a modifier, you can key the number, and you can just tab through these fields. Hit the drop down, choose I know this doesn't make sense, but I want you to be able to see the modifier in the column. I can have more than one modifier per procedure code. And as I tab through, I could, if I needed to change my date of service, I could do that. Or I could make this a date range. If there's a series like hospital visits, on Monday, Tuesday, Wednesday, or he went on, the 23rd, started on the 20th, and his last visit was on the 23rd, I could set this back to the 20th, which I would want to be on my 20th day sheet though. Maybe, because it ends on the 23rd. And notice what happens to the units down here. It's automatically going to adjust my, if I put my date range, it's automatically going to adjust my units and increase my charge and send these out the door. And when they're going electronic, it's 4 different charges going out the door, but I only have to key it the one time. So just keep that in mind. Let's go ahead and just set this back to the 23rd. Here I have my doctor, and for practices that have mid-levels, this can become important. So the red arrow tells you this is the person that provided care, but if you want to see the billing, click on the red arrow, and the billing provider in this case is going to be the same. There are going to be scenarios where that's going to be different. Let's try and find one. Yeah. So here, the billing provider is provider number 33, where the rendering provider was provider number 2. And so the way this looks on the system would be, or what I would recommend. Let's say that Michael Hart is a billing provider and Sam Euro is a mid-level that works for Dr. Hart, and Sam is not credentialed, so all of his billing goes under Dr. Hart. I would put Sam in as Sam, comma, Hart. So I know that Sam is the rendering, but Hart is the billing. Anyway, this just lets you see that, and so you know that you have the ability on the fly. It doesn't matter who the patient's associated with. And the reason Dr. Primary pulled in as the billing provider is because that's whose schedule the patient was on. We can override that during the time of charge entry. Going to the bill flag. The bill flag is important because it tells us where the claim is going to go. Are we sending it to patient responsible, meaning it's going to immediately send a statement out to the patient, or are we sending it out to an insurance company? If there's primary insurance, you're likely sending it out, and it's going to default appropriately. If there were no insurance here, it's going to automatically drop to patient. And finally, your diagnosis pointers are going to happen automatically, but it's going to associate all diagnoses or the first 4 on the system with that code. If I needed to change that for any reason, I would just simply key over that and say I only want number 2 related, and the other 2 items, and forgive my coding because I'm not a biller, the 1 and 3 are going to be related to this charge. One other thing that you can do, and I'm just hitting Control N, which is the same as doing new, or I could keep tabbing through from that row, and let's say this row's an error, I just highlight it and delete it and say yes, it's just going to take that row off. But once I'm at the end of this row, if I hit enter, it opens up a new row. I want to point out that I can do a note on the system, and this is not going to go out to insurance. It's just something that I can do to reflect on the screen to make it easier for me, and you can type anything you want here. It's limited, as you can see, what's going to display, but I can type it on there. Okay, I'm going to go ahead and delete my row for my note because I don't really need that. So once my charge is complete, I can see the total at the bottom. You have the ability to have the system calculate as you're keying in what the patient might owe you in the end if you want to, and that's a feature you can turn on or leave off. And once the charge is complete, I'm going to hit save, and that's going to open my claim transaction window if I'm billing to insurance. The claim transaction window, and the yellow you're seeing, this is a claim scrubber tool, so keep in mind that that's an add-on product and everybody won't have that. Here's where if I have an accident or I associated a case, I would see that here, and we'll look at that on the next charge. Referring doctor information. Assignment of benefits, that should pull over from maintenance and plan under the maintenance drop-down. That's going to pull over when we set up the plan. We always want to set those up to assign benefits. Any authorization number, any block 19 information, anything like that you might need. Additionally, the more button, and I'm going to go ahead and click on that for any kind, let's just say this was an injection. I use my little sheet of paper here. This is where all of your line level, I'm going to click in the line level section here and hit insert. If I had an injection, all my NDC and unit measure and stuff would be here, and if you needed to override it from your defaults, we could do that, and we'll look at a claim with that as well. Okay, so everything in this charge looks pretty good. If everything, normally when you come in here, you're just going to be clicking OK, and that's going to save the charge. And that charge, notice, is new, is now set up for insurance, and it's ready to go out the door. Now, I'm going to highlight this row, and I want to put a check mark in the box. Notice my menu. Watch your posting sequence menu. What happens? I'm going to uncheck that box, and I'm going to check the box again. Let's go over these options. When I check that box, a number of things open up. I can create a sequence note to put in some notes specific to that data service. I can change the responsibility from insurance to patient or patient to insurance. Let me just open that window. Just allows you to set a new aging date, and it's going to automatically rotate. If it's set to insurance, it's going to then push that claim to the next level, which if the patient has secondary, it would push it from primary to secondary. If the patient did not have secondary, it would push it from primary insurance to patient. If it's sitting at patient and I do change responsibility, I can rotate it back to insurance. Let me show you on this patient sequence. I can change responsibility. Well, they don't have insurance associated with that one. Let's go ahead and do this one then. I can change responsibility here. I'm just going to leave the aging dates, but I could change them if I wanted to. And notice it rotated to the next carrier. If I do it again, it's going to rotate it to patient. Leave my dates. Watch here, it's going to change to patient. Or actually, it's allowing me to accept where I want it to go. I could have changed the insurance. And if I keep rotating, now we're seeing patient. And I can put it back to primary because maybe I need to send it out to primary. So that's your change responsibility icon. Edit claim. This is a good one, and I'm going to go ahead and go in that. It's automatically going to highlight this current, where I selected the edit claim was on this date of service. And it's saying it's set out to Medical Mutual of Ohio. I could change that right now if I wanted to. Or I can go in and see what kind of things can I edit. Well, there's a number of things. I can edit the status. It's set to print, but maybe I say, you know what? I need some information on my injection, so I'm going to set it to hold. That way it won't go out to the insurance company until I take it off of a hold status. I can change the bill flag and make it a patient responsible sequence. Because this is maybe the patient no longer has insurance, so I want to go ahead and just get this billed out to the patient. I can come into the More screen. If you're using any kind of UB billing, come into the Extra button, and you'll see as I scroll down UB04. Well, I don't have the form set up for it, but if you have UB billing going on, we can set that up, and that would take you into all of the UB fields. Claim documentation is something, well, this is just claim level, allows you to add some documentation to the claim, but there is also the ability to have claim attachments being built into the software. This is really helpful. I think it's in use in part through our clearinghouse. Now, if you're going through the medical software clearinghouse to send in claim documentation for, claim documents associated with a claim like work comp stuff, I can just cancel out of the screen. And then More, remember, allows us to go in and see the adjudication information. If you've already had primary payment, would show here. Insurance type code if it needs to be set for any particular carrier. If I were sending a corrected claim, I have the ability to set that here so I don't get that rejection of a duplicate claim. I can show it as corrected and give the reference ID assigned by the carrier for that particular claim. I can come into the 2400 loop information by clicking under line level and hitting my insert button, open up all my NDC boxes and set some information on that if I needed to, or change it. I would see the adjudication as well. I can add notes. We'll cancel out of here. So you can see there's quite a bit of information that you have the ability to get into to edit your claim on the MicroMD side. Okay. What else do we have? Split the sequence. Just like when we did the right click split sequence, you have the ability to access it from here. Batch options, again, we'll get into that with payments. Void. If I have a data service like this that only has charges, it does not have any associated payments, and it's an error, I posted it wrong, I just need to get rid of it and start over, I can put a check mark in there and hit my void. It's going to ask me if I want to void. It's going to completely reverse and delete this. I'm going to say no, but you can do that. And it would just simply disappear and you would rekey it in. Copy. If you have a patient that comes in, in fact, let's go ahead and void this. I'm going to go ahead and say void, and it's gone. So now let's just say that what happened here, let's look in this sequence, all of these charges are exactly what I need to bill out again. He comes in every month for this. So I'm going to check this box and say copy that sequence. I need that. There's no sense in keying it all in if it's going to be the same thing. So it carries over the insurance information, all of the diagnosis codes, and all of the charges, all of the same billing information, including modifiers. On a live or production system, the date would change to current day. It would be reflecting 11/23. And so I'm going to go ahead and set it to 11/23. Wrong year. And it would normally set it for you automatically. And I'm just going to go ahead and delete. Let's just say I only want to do the 9923 because I don't feel like changing all those dates. So I'm just going to delete these rows. But you see where you can copy a data service and not have to key the same thing in over and over and over. Additionally, explosion codes. These are the ability to create charges like under a physical exam or some kind of immunization. Let's look at physical. These are all the things that we would put in a physical. So I can set that up, and when I come in and I open a row, I put my @ symbol in here. I can either put my @ symbol and bring up a list of them, or if I know the name of the one I want, like physical, I can type in @physical, and it's going to populate all of those codes that we saved as this explosion code. So I'm not having to key them every time. It also has a built-in recall system, and it says, hey, when you're creating this, do you want me to set up a reminder for 1 year? And if I do, I just hit create. And that's it. The system's automatically going to create a recall on that particular service. So when I run my recall report, it's going to remind me that this patient is due for a physical. So that was our copy. Allows you to copy a prior data service. Just the only thing you have to do is review it, take out any line items that don't apply. Make sure your dates are correct and save, and you're done. Billing inquiry allows you to get into the patient ledger. Delete, you're not really going to be able to delete accounts because they have to have a non-zero balance before you delete them, and I don't really know of a whole lot of reasons why you would do that. If you want to print a claim for just this single data service, there's a way to create paper claims in batch form, but you can also do one on the fly, and like I've done here. And so I'm going to save that to my desktop as HICVA, and we can look at that claim. Let's go look at that. And I don't have the form built in the background, as you can tell, but it's going to go ahead and print this on one of your pre-printed HICVA forms. Okay, so that would allow you to create a claim. The other thing it's going to do, and let me come into this patient's demographics real quick. I did Control F5. Control means I'm working in this patient. F5 is my patient shortcut. So Control is just saying, just stay with this patient and go into the demographics. And the reason I wanted to do that is I wanted to look at appointment history and see if he has any future appointments. Current. He does not. So let's go ahead and schedule him out real quick, because I just hit my F12, recall the last patient I was working in. We're going to just do a follow-up and hit accept. I just want something on there so that I can demonstrate to you what the receipt will look like when the patient has future appointments. Okay, so here, if I wanted to print a receipt for the patient, I would hit my print receipt icon in laser, and I'm going to call this sample patient receipt. And let's go look at that. When we print a receipt for the patient, normally the charges aren't already entered, but if the charges are entered, it's going to give them that. It's also going to show them if they made a payment. And then it's going to show them under this section for scheduled appointments, it's going to show them their future scheduled appointments. Okay, and let's go back here. And exit window. That takes us out of the window, or it just closes out the patient. And we'll go ahead and save that. And notice that Peter fell off our list. He was charge slip number 1. Because his charges are posted, he's going to go ahead and fall off the list. And so we're going to double click on the next name, because that's the next encounter that I need to post. And I'm going to look at the diagnosis codes. It's bringing in his automatic diagnosis codes that are related to this medical case. I can switch over to the work comp and notice that changes. But I have a medical case because these are his chronic diagnoses, and I don't want to have to key them in every time. Let's go Control F5 and look at the demographics to show you that. Under the Cases tab, we have a case called Medical. And Medical has these associated diagnoses. That's why those are loading. I didn't need to click on that. If you don't want that to be the case, then you simply choose Case as None and keep going. You can key over these with the appropriate diagnosis. You don't have to keep what's in there. If I'm not sure of what a diagnosis code is, I can type in the name and then choose the appropriate code. Or I can type in a partial code and look up from my list. I can also, just like throughout the system, put a % sign in and pull up everything in my database. So it's the entire code database. Now that can be time consuming depending on how in depth your listing is. If you've installed everything possible, it might take a little longer. And so notice my cursor is blinking in Diagnosis 5. If I hit Tab, it takes me right in to key in my office visit. I could change the provider using my up and down arrows on my keyboard, or I can use the drop down list if I wanted to change them. And then I can continue tabbing and it opens up a new row. And don't worry, you can turn off these payment calculation windows and so forth. Now, notice plan visits open. If you set up plan visits, let's go ahead and do this 90788. And it's telling me that it's inactive. But that's okay. I'm going to go ahead and post it. It's just, you have the ability to expire out codes on your system. Okay, and so, but I want to go ahead and post it because I want to show you that it's going to count down from that number 8. And so we have all that, and it's also an injection, so we can do some line level info. Let's just say those are my only charges and I'm done. I can exit window, and it's going to ask me to save, or I can hit my save icon and exit. Let's go ahead and just say exit. Yes, I want to save my changes, and it creates that new charge. First, it's going to take me into the claim transaction window. I want to go, because I have an injection, I want to go to the More screen, and I want to come under here and look at line level. It's not there. Okay, so let's back out of this charge, and I want to show you something that's going to be really helpful if you're doing any kind of injections. 90788 is my code number, and I'm going to go ahead and, well, it's going to go ahead and create this charge. That's fine. Let me close the demographics. Now, notice how I push this and it's off my screen. I don't have to move it so I can get to the exit button. Anytime you have in the Windows environment a little picture icon here, you can click on it and close, or you can just double click on it and it automatically closes. I would like to go, let's go ahead and close out of Anthony, and notice he fell off our list. We're done posting him. I want to go to maintenance and procedure, and I want to pull up that 90788 code. 90788 code. Remember, it told us it was not valid, but let's look at why. Here it said active through 10/22. I can just take that out of there, and now it's going to be fine. The other thing I want to do is populate NDC code, which is probably wrong, but that's okay. If I need a unit count, a unit price, and unit measure, I can set all of that information up at the procedure code level so that when I put it in next time, it'll automatically be there. So I'm back to charges and payments, and notice it keeps track of what I still have left to do. I can even exit completely, come back into my charges and payments for day sheet date 11/23, and it's going to bring my list back up where I left off. And I can continue posting. So I'm going to double click on Edward Jones, and we're going to post him. And we're going to make sure to do a 90788. It's giving me his diagnosis code if I want to use that. And remember, you just hover and drag and drop into that box. You got to make sure your cursor changes to this eye. See the eye? When I do that and I left click hold, it turns into a circle. If my cursor is still the arrow and I left click hold, nothing happens. It's got to be the eye hovering over that box. Okay, so I'm going to tab and do my 99213. I'm just going to tab all the way through, and I'm going to open up my next row, and 907, oh, now I forgot the code. Was it 90788? Yes, that was it. Okay, everything's good. I'm going to go ahead and save. I can hit my save icon. I can hit Control S, which is what I'm going to do to save because it's quicker to me. And that saves, oh, he didn't have insurance, really? Wow. Let's delete that. I'm going to void that because I want to make sure he has insurance. Void. And that's something to watch for, so that's a good lesson. Yes, I want to save my changes. And let's go into F5, and I'm just going to F12 because I was in Edward Jones. And I want to go and make sure he's got some insurance before I bill his charges. So let's just give him plan number 1 on the system. Maybe not. This will work. I'm going to save that. It's asking me, because he has dependent accounts, since I added that insurance to him, do I want to update them? It'll add the same insurance information. Well, normally it would work just fine. The relationship error is I should have said they're the natural child, whatever the appropriate one is. And then I wouldn't have gotten the error. But since I've done that, I have to make the change. In fact, I could just make a change to it and hit save, and it's going to ask me again. It should. Well, maybe not. But anyhow, if I had not messed up. Okay, at least he now has insurance, and I can go back into charges and payments and pull him back up. I'm going to, I could hit new, or I can do that. It's not going to automatically open for me because I had already closed it out. And we'll do $401.9. Is that right? Yeah. Okay. And I'm hitting tab. 99213. It's my first row. And then 907. Not it. 90788. Notice how I'm just typing over that since I made a mistake. Okay, and so that's in there. Now I can see he has insurance. Before, this green line was missing. That's why I didn't get my claim transaction window. Okay, so that's once I save, now I'm going to get that claim transaction window that I needed to show you under the more screen. When we look at that injection, this time when we come into here, you're going to see it's automatically showing you the NDC number, unit price, unit count, and unit measure. I just wanted to show you that you have the ability to automate that. You don't have to do that manually anymore or claim by claim. It's going to happen on all, but you have the ability to get in there so that you can edit or override. All right, before we go into Chris, I want to go check his insurance, 401.0. So I'm going to F5 and go 401.0 to get into his account. I want to make him a person that has a Medicare secondary insurance. So we've got Aetna, and I'm going to add a new plan, a secondary for Medicare. So we're going to look for Medicare. There we go. And put in his social for the plan number with the letter A behind it. When you have a Medicare secondary, check the Medicare secondary box and set up your MSP type code or your reason code or your insurance type code, whatever you call it. Normally a 47 code, but you have to pick the appropriate per patient. What'll happen is when you go to bill your secondary, it'll automatically formula or set up or configure that claim for Medicare secondary. There's nothing special to do, nothing you have to edit down the road. Okay, so I'm going to go ahead and make me a note of this account because we're going to look at it in our payment training. Okay, so now we can post Chris. We're gonna make our posting simple from this point forward. I'm gonna go ahead and just give everybody a 401.9 diagnosis code and an office visit of 99213. I'm gonna save my charge, and that's it. The next thing I'm gonna do is Control X to close that window and go to my list. Notice how they're falling off my list as I post them. 401.9. Of course, you're going to be looking at your paperwork on your desk, but you can see where this is extremely repetitive. I'm back down to my list. I'll verbalize what I'm clicking on my keyboard as I do this. I'm double clicking the patient name. I'm just starting to key in my diagnosis code. I could key in a second one if I wanted to, or just hit tab to go open the next row. I'm putting in my office visit. I could tab through, hit Control N to do a second line. Once I'm done, everything looks good. I hit Control S to save, or hit save icon over here. When I get into the claim transaction window, if there's nothing that needs to be added, everything is as it should, I can click OK. Or because you see that underscore on the letter, I can hit alternate on my keyboard and the letter O to close out of that. I come back to this patient sequence window. I can either hit exit window or I can hit Control X on my keyboard. It takes me back to my charges and payments where my list is, and I'm down to 2 patients to post. Continue posting. And by the time I'm done posting all of my patients, I should have no names left. If I have a name left, let's just say I don't have an encounter for Mary, I know that I have to do one of 2 things. I have to see if Mary even showed up for her appointment. If you're using check-in and check-out, you would be able to open check-in, check-out and see if had she been checkmarked. If you see that she was arrived or you see that she was completed for that day, and notice the date, I would have to make sure to open my calendar and go back to the 23rd to look for that information. That's one way. The other way would be to if you're using check in, check out, as you process your day, it'll show if she's a missed patient. So, you know, that if you're not using check in, check out, then you basically have more of a manual process where you're going to check in with whoever you would check with your office. Now, I'm not ready to close that day because I want to check on Mary, but I'm done with everything I can do. So I'm going to exit, and I can move on to the next day. If I'm posting and I'm ready to start posting for the 26th, I can go ahead and move on. Notice that it's showing some activity there. And that is our daily close training, is where we're going to look at that process. But I could toggle over to the 26th, hit accept, go in my charges and payments, and begin posting my charges and payments for day sheet date 11/26, which is not blinking red, so that tells you that's the current day. If any encounter forms had been printed, they're going to pop up, and I'm going to do the same thing to post them. Now, you don't have to use your charge slip list to post. You can just, from your paper encounter, key in your patient information here. It's more work, but you can do it. And when this sequence screen opens up, you're just going to hit the word new to create a new data service, and that brings you to this place. I'm going to say exit because you can see where it's a lot easier just to double click on the patient name, and that takes you right into where you want to post. Let me go ahead and turn off a setting that you've seen me close those yellow HIPAA windows over and over and over. I'm going to go ahead and close that up. It's doing that because I have the system set to notify on all patients about HIPAA privacy. I don't want to have that set, and I don't want this either. Okay. So now that won't happen anymore. All right. Let's recap on our charge entry. Go to billing, charges and payments, or your F6 shortcut, or use your icon here. Make sure to keep track of what day sheet you're working on. Your date of service and day sheet dates should match. I want to post only patients that were treated on 11/26 on my 11/26 day sheet. Encounters that are associated appropriately with a day sheet will populate, allowing you to quickly access that patient account for adding a new charge. You don't have to use the charge slip list. You can simply pull up a patient account by keying in the account number or name and then clicking New to create a new data service. This will conclude our training for charge entry.